I would say one of the most exciting experiences we had lately was in trying to get community cafes going around Westbury. Community cafes are meaningful parent-to-parent conversations where they talk about their wishes and dreams for their children, and they come up with strategies that they can use to help that situation, whatever it is they describe it. And so we brought together members of our leadership team. We had some 60 people who brought around 30 parents to a room, and we had experts from around the country come in who helped us organize this. And they developed a set of questions that respected everybody in the room. And the group was divided among African Americans, Hispanics, mostly who spoke no English, and Haitian parents who also spoke no English. And we had simultaneous translations going around the room. And they talked about what they wanted for children, and they were the same regardless of what group they were in. And the experts sitting around the perimeter were really surprised to hear their voices, because these are the people who are rarely asked. And at one point in the session, one of the Haitian women wanted to get up and express herself, and she asked the translator to come over and do it for her. And the facilitator said, you know, sometimes when we think somebody doesn't speak English, we don't give them voice at all. We're going to allow her to speak, even in her native tongue. And this parent got up there and started speaking very shyly initially. And then you could tell she was very impassioned about what she had to say. And by the end of it, she was really in full throttle and expressing herself rather emotionally. It was a beautiful thing to see. And I don't think we understood the words. We just knew that what she had to say was important to her. And then when it was translated, we did fully grasp the meaning. But to her, to this woman, it was one of the most amazing things that she talked about it at the end. And on the evaluations, everybody in the room talked about that moment of realizing how many times they have spoken for somebody else because they didn't speak the language, when in fact we have to do everything we can to help these people have some voice in the community because they have needs and they're trying very hard to survive. I think one of the most important things that has to happen with community advocacy is that we not stay in our silos to make it happen. The kind of needs that community people have is not just health and not just mental health or not just child care, whatever it is. It's a family system that has a whole range of needs. And we have to be working collaboratively with the other members of the community who are also working with these families to give them some dignity and some respect and not ask the same questions 80 times in a different office, especially when it's a personal matter. So we're finding these community coalitions where pediatricians are joined by the librarian, the superintendent, and the head of the Chamber of Commerce to think about how to approach the members of their community. So we just got to break down the silos that have been created by funding streams and by regulation that keep us very apart when the people we're serving are all bundled up with a whole set of needs that we can work together better in solving. And I would say also that it's real important to try to integrate health, early childhood, social emotional development of children into civic issues in our community. Right now there's whole discussions of $100 million worth of economic development money that is poured into Long Island, and no one is looking at the implications for health, for families, for children. That's unconscionable because A, why are we doing economic development in the first place? It's not to improve our quality of life. But secondly, there are ways to construct buildings with safe passageways and arbors to reduce stress and improve allergens and all those kinds of things. There's a way to build a healthy community, and we need health professionals and others at the table with these bigger discussions that they don't understand, that is economic development, are related to the work that we do. I would say the same is true of social justice. That we need to be talking about the inequities, the achievement gap and such, in a social justice way to understand why it's important to invest universally in health, in education, and in welfare. I think the most important thing for aspiring community advocates to do is go out, taste it, feel it, touch it, understand what's really going on in the lives of people that you're serving. You'd be quite surprised of what they're doing to try to make it. It's hard. It's very difficult lives out there. And when you see it for real, you better understand it, and you'll probably come up with better ideas for how to address it. First, I'd say there's a tremendous need out there for the expertise that pediatricians have. Please remember that among parents, and even in a recent poll we did of the public generally, not just parents, who came up as the most respected messenger about issues related to children are pediatricians. So don't underestimate the clout that you have in the community, and to use that when possible. I think in terms of how the Early Years Institute can help pediatricians, we have a lot of information about what parents need. We have done surveys of pediatricians' waiting rooms and have a whole list of ideas of things that can be done in waiting rooms to better entertain children, especially without using screens, obviously to reinforce reach out and read and other literacy strategies. We have referral sheets for the basic services that pediatricians might want to refer their patients to. So there's lots of resources at the Early Years Institute and numerous other agencies that if pediatricians are willing to distribute them and suggest to parents some tips for where they can find ideas, that would be enormously helpful, because I think that's what parents are left to a sea of agencies and internet sites and bloggers all giving a lot of advice. And I think the one they wanted from those is pediatricians. And I think we can help you provide some of that information. You don't have to recreate it to give to your patients.